The mission of Wilmington Public Schools' comprehensive school health program is to maintain health for all aspects of development so every student will succeed in school physically, emotionally, intellectually, and socially. In order to accomplish optimal wellness, there must be a strong link between parents, school, community resources, and the school health office. The presence of school nurses in each school building allows for many of our students to attend school and have their medical and safety needs met. There are many students in our schools with special health care needs. The most common medical condition is currently asthma. District-wide, over 300 or almost 10% of our students have asthma. Many of these students keep a rescue medication called albuterol at school for asthma exacerbations. Our younger students need assistance with the use of their inhalers and oftentimes may need their albuterol administered by equipment known as a nebulizer or with the assistance of a spacer. The presence of a school nurse allows these students to receive their rescue medication in a timely fashion, and the majority of the time the school nurse assessment and treatment allows the student to return to class and continue their learning. Asthma exacerbation can have many triggers, and even our secondary students depend on the school nurse for assessment, treatment, and referral when called for. Every school in our district has multiple rescue inhalers in the health office. Our goal for these students is to control triggers, prevent exacerbations, and whenever possible, avoid the need for emergency room treatment and/or hospitalization, resulting in disruption of their education. Multiple students in our district also have food, insect, latex, and medication allergies. These students require immediate assessment if they are exposed to an allergen and, if warranted, they may have to receive immediate treatment with emergency epinephrine via an EpiPen. This year, district-wide, there are over 100 EpiPens on hand in our schools. The administration of an EpiPen requires careful monitoring until emergency medical care arrives and mandatory transportation of the student to the closest emergency room for further assessment and care. There are multiple students in each grade that have these life-threatening allergies. Many of these students also require additional treatment with albuterol inhalers and Benadryl, an antihistamine. Currently, several of our students have multiple food allergies. Our school nurses educate and proactively ensure prevention of exposure to allergens and develop emergency action plans for response in the event of severe allergic reactions. The key to avoiding an allergic reaction from foods is to avoid ingestion of the offending allergen because it only takes one bite to cause anaphylaxis. The ultimate goal is student safety when it comes to caring for students with life-threatening allergies.
At the elementary schools, there are 5, 6, and 7-year-old children with type 1 diabetes. These children require close monitoring of their blood glucose levels with specialized equipment several times during the school day. They do not have the ability to assess blood glucose results and take appropriate action when needed. Some may need insulin administered by injection or via an insulin pump before lunch or if their blood glucose level climbs too high. The school nurse's role requires careful assessment of daily blood glucose levels. These students are at risk for facing a life-threatening situation if their blood glucose level drops too low. Medication called glucagon is kept on hand for children with diabetes in case of an emergency occurrence. This medication must be mixed and injected by a school nurse as required by the Massachusetts Department of Public Health. At the secondary level, there are several more students with type 1 diabetes attending our schools. While many of these students are more skilled in managing some aspects of their diabetes regimen, they also keep emergency glucagon on hand. Unlike years ago, children with type 1 diabetes now follow a much more intensive regimen of care. We also have students in each grade that require the assistance of medication to benefit their learning process. These drugs are controlled substances and psychotropics that are strictly regulated, and the school nurse, per Massachusetts law, must manage their administration. Students also at times are required to take other medications on a short-term basis, and the school nurse will administer them at school so they may resume their education sooner. There are also students attending school with seizure disorders, many of whom require emergency treatment if their seizure activity lasts longer than 5 minutes. Emergency medication may be kept on hand for some of these children. This medication may only be administered by a nurse at school. All of these students have seizure action plans in place, and in an emergency, they would be transported to the hospital for further assessment and treatment. At the elementary level, there are a few more that require nutrition to be administered via a gastrointestinal tube during the school day. The school nurse administers tube feedings to the children using a special pump. Health education is provided to students and families on a daily basis. A number of students are seen with various complaints ranging from the need for tying a shoelace to scraped knees, sore throats, earaches, headaches, and stomach aches to unusual rashes, behavioral changes, and potential contagious diseases. With every student encounter, a nursing assessment is made and parents are advised about health management or the possible need for further evaluation by the child's primary care provider. Health screenings are performed in school, such as vision and hearing, scoliosis, and physical exams. School nurses assist our families and students with referrals to healthcare providers, community resources, and public health insurance. Oftentimes, the school nurse is a lifeline to families in crisis, in isolation, or stressful situations. Families are carefully navigated through the complexities of the medical and educational systems, and during difficult financial times, families are referred to outside resources as well. In conclusion, this presentation showing the many healthy and happy faces of our students reflects the ongoing mission of school health services in striving for optimal health and wellness.